After years of climbing, opioid overdose deaths have dropped for 2 years straight. But CBS News has learned that a federal program credited with helping drive that decline is now stalled. Its grant money delayed despite being approved by Congress. It's part of a larger $1 billion backlog of delayed grant payouts at the Department of Health and Human Services. Our medical contributor, Dr. Céline Gounder, joins me now. So, Doctor, what did this program do and how did it help?
So the CDC program called Overdose Data to Action, or OD2A, supported health departments, state and local health departments across the country in numerous different ways. So they helped support by providing or paying for naloxone, also known as Narcan, which is an overdose reversal drug. They helped pay for staff that would follow up with people who survived an overdose to make sure they then got into treatment so that they continued to survive. They also did things like tracking, was there fentanyl or xylazine in the drug supply. And as a result of these programs, we've seen a 25% drop in overdose deaths since 2023. So that's really quite significant when you consider over 100,000 Americans were dying from overdose up until recently.
So what happens when a careful, methodical, planned out program like that just goes away?
Well, it's a really great question. So what we are going to see is even as soon as next month, some of these programs could be forced to close. And when you have programs that are literally life-saving, helping prevent somebody from dying from a drug overdose, we can certainly expect for these numbers to go back up again.
And why is this happening?
Well, the administration says it's reviewing spending to make sure that there's not waste, fraud, or abuse. But instead of giving the CDC all of its funding up front for the year, as would normally be the case, it's giving it in monthly chunks. But the problem is, and the CDC is especially hard impacted by this because 80% of their budget actually goes out to state and local health departments, which people don't, I think, fully realize. It's not sitting there in Atlanta, it's going out. And if they don't have a full year of funding, they can't send those grants to the state and local health departments. So the spigot of funding just turns off. And what we're worried now is, on top of that, if the funding doesn't get spent as budgeted, there's something called rescission, where the administration could say, you know what, you haven't spent it, even though you haven't had time to spend it and the ability to, we're just going to take it back. And that could result in real cuts.
Right, indeed. Dr. Céline Gounder, thank you so much.